All right, everyone, getting back to the story of the day here. Oscar Health, backed by Google parent company Alphabet, making its trading debut on Wall Street. The health insurance company, which uses online, mobile, and at-home methods to enroll customers, says the number of its customers grew 70% year over year during the coronavirus pandemic. The IPO priced at $39 a share, and that equates to an offering size worth $1.4 billion. The company started trading under the ticker symbol OSCR on the New York Stock Exchange today, where Oscar Health's stock opened slightly lower at $36 a share. There you're taking a live look at where things are trading right now. And joining us now is Mario Schlosser, who is the CEO and co-founder of Oscar Health. Mario, great to have you here with us today, and thanks so much for taking the time. Congratulations to you on the team on this milestone occasion. Why did you think and believe that right now was the right time to go public?
It's great to be here. Thanks for having me on the program. So I think it's two different factors here. One is that we started the company 8 years ago because we thought the healthcare experience in the US leaves a lot to be desired. It's too complicated, it's too costly, too hard to navigate the healthcare system. My son was born in 2012, he was here earlier, my daughter as well, writing the name on the wall here. Those are kind of difficult to navigate healthcare experiences if you have to go through them in a US hospital. And so we thought that a member engaging insurance company that's built on its own technology stack can make a huge difference in that, and that's what we built in Oscar. So one reason we're in public now is because I think we really have the proof points to show that we've been able to grow a lot, reduce our medical costs, and most importantly have the highest member satisfaction, member engagement of any insurance company out there. That's a powerful package of proof points. We want to show that to the public markets. And the second reason is that the healthcare system as a whole is moving in the direction of where we think it needs to be going. It's consumerizing more, it's virtualizing, digitizing more, and risk is getting shared more between payers and providers. And that's kind of the more integrated, more member-friendly, more technology-driven world we want to be living in. Certainly. As a health insurance company, and we've been out there driving that. And so I think it's a good time to go out and tell that story.
As we were just looking at some of the areas that the business operates in, when we think about the role telemedicine and the customer support that's required there, also takes into account in this changing environment. What percentage of doctors' in-person visits do you believe might be replaced by virtual visits in the future? And how would that impact practitioner operations as well?
It's a great question. So we study all the time our claims data as an insurance company, and I can tell you that for all claims in 2019, before the pandemic started, 2/3 could have been done virtually. Now, it's not 2/3 of members, it's 2/3 of claims. If you manage a diabetics care, for example, 2/3 could be through virtual, but 1/3 would have to be in person still. And so we run a medical group called the Oscar Medical Group as part of Oscar. And that group is you are able to pick a physician there in the cloud as your virtual primary care physician. That care is free, but you can also see then care in person that's also free. And that way, I think in a very unique way, we can manage you as a member longitudinally and with a better experience and in a more affordable way. Because we sort of like run both the insurance company and the medical group and have built the infrastructure underlying all of this at the same time as well. I think it's clearly going that direction. There'll be some big fights in the healthcare system because a lot of US healthcare has been built to see people in bricks and mortar in fee-for-service charges, where if the visits drop, that's a problem for a big part of the healthcare system. And so we are out there actually as partly an insurance company, partly a software company, technology company, enabling health systems to go down that route of virtualization and consumerization. And so we built health plans, for example, with health systems in Florida, in New York, with the Cleveland Clinic as well, and I point in that direction of that future of healthcare that's more integrated and more blended, if you will.
Now, with the data that you have access to and serving 529,000 customers across 18 states, what product lines do you plan to expand into, and how would they avoid services offered by practices that already use your platform, or would they directly compete?
So we're in the individual market right now. That's still our bread and butter. We're in the small employer market, employees under 50 employees, and we're in the Medicare Advantage markets, folks over 65 years old. We honestly think in those three markets we've got a huge amount of growth ahead of us. Individual markets are now growing again. The Biden administration will likely put more money into subsidies there. That'll be a tailwind for that market. The other markets are going to keep growing as well. And we've got lots of white space and expansion there. So right now that's where our focus really is. I'll tell you, in the next 10 years, I think the entire market will individualize. You'll be able to buy an end-to-end experience in healthcare hopefully from Oscar. No matter who you work for, who gives you kind of like the money for buying that experience. And that means we can invest in your healthcare 20, 30, 40 years down the line, as long as you like being with Oscar. That's the place you want to get to, and we hope the US healthcare system is moving towards. We don't think we compete in any way with the care delivery partners we have. As I mentioned, we actually built health plans, and we enable health systems, hospital systems, to kind of individualize and digitize. And we did that, let's say, with the Health First system and the Advent Health system in Central Florida, Orlando, and the Space Coast there. I think that, to me, is the future of healthcare. Payers and providers working much more closely together.
Right.
You need a modern tech stack for that. You need member engagement for that. Those are the two things we bring to the table that I think nobody else has in this way in the healthcare system.
Mario, early in the pandemic, we heard from healthcare experts and officials who acknowledged the vulnerabilities in healthcare that the coronavirus had exposed. What do you anticipate will be the largest changes to healthcare post-COVID to remedy the risk profile of the broader industry?
I think, again, consumerization, it's got to go more towards choice. If you lose your job, you shouldn't lose your health insurance coverage. You shouldn't. And that data that's sort of like driving your healthcare, they're describing who you are as a person, shouldn't get lost in the way that it does right now. It doesn't really make any sense for the system to work this way. It's going to keep shifting towards virtual and digital, but it's got to be in a way that providers and payers jointly take risk for the outcomes. And then I think you can get towards a system where I buy Oscar, I stay with it for 40 years, basically, and we can invest in your health 30, 40 years down the line because you like what we're providing you in healthcare there. That's where I think it's going very much. That's the system's getting yanked into that direction. And I think the most brilliant of hospital CEOs are realizing that. The most brilliant physician leaders are realizing that. And I'm glad we can play a part in kind of helping the technology shift in that system as a technology-driven insurance company.
Mario, I gotta go rapid fire here on these next couple questions, but you alluded to this earlier, so I wanted to come back to it. Oscar has acknowledged exposure to the ACA, which President Joe Biden seeks to essentially rebrand. What elements of the ACA would need to remain intact in order to mitigate this risk factor for Oscar Health?
So I think the ACA market is going to grow. There'll be more subsidization coming into the markets. I generally think it's actually a pretty intelligently regulated market. What I would not want to see is that somehow the regulations get softened up so that it's a race to the bottom on the kind of benefit design side. The benefits should get richer, subsidies should get higher, and I think that's where it's going. And anything that gets people into coverage, I think, is great. Too many people uninsured in the US still.
And then also, while we have you, since we were talking about the data that also the healthcare industry is able to take in right now because of digitization and customization and what that leads to, Amazon, Walmart, other tech giants, they too are getting into the healthcare space, even amid scrutiny that big tech companies face for their ability to dominate markets that they enter into. Would any foreseeable regulation passed to them have an impact on the way that Oscar operates?
In the following sense, perhaps, I think anybody coming in from the technology side into healthcare will make the system more tech-driven and more consumer-driven. That's the battleground we want to be on. Healthcare has inflated at 4 or 5% every year for the past 30, 40 years. It's not working for the American people. It needs to become more consumer-focused, and what we need for that is much faster iteration of new ideas, new benefit designs, new ways of dealing with helping the consumer, really. That is what we have built as a technology company. I think that is the pressure the other tech players are going to put on this system. Right. I think it's a move in the right direction, away from the kind of local oligopolies it otherwise is.
Lastly here, as the nation reckons with different treatment that has become even more present and elevated to the top of conversations as well of ethnic groups across several aspects of society, I wonder in what ways Oscar Health seeks to address the disparity in access to health treatment and affordable options for consumers.
I love that question. To me, the highest good of Oscar is we engage members on our own technology platform to save the money on their healthcare. That is really everything that comes back to that. Cost of healthcare is the biggest impediment to quality of healthcare in the US. End of story. We do a ton of work in, whether it's on the virtual side and redesigning our drug tier, redesigning our benefit design to get people more affordable plans, and I think that's what we really have built in a great way. We do a lot on the equitable, on bringing more equity into the healthcare systems as well. We have an initiative, we have a system of grants that goes to players in the healthcare system that drive towards more equitable healthcare from an ethnicity point of view. We can use our own data to get people to physicians who can treat their particular backgrounds, family backgrounds, ethnicity backgrounds, so on, in better ways. That's what we built our systems for. That matchmaking is a core part of the Oscar care routing system, and you'll see us do much more in that direction as well going forwards.
Mario, again, congratulations to you and the team over at Oscar Health on this milestone day for the company. Would love to check back in later on in your life as a publicly traded company. Mario Schlosser, who is the CEO and co-founder of Oscar Health, joining us today.